Hello, medical entrepreneurs. I'm Dr. Adam Sewell, and today we're doing a deep dive into TB500 or thymosin beta-4. This peptide has become increasingly valuable in our regenerative medicine toolkit, particularly for its remarkable healing and tissue repair properties. Before we discuss clinical applications, let's understand what makes TB500 unique. This 43 amino acid peptide is actually a synthetic version of thymosin beta-4, which occurs naturally in our bodies. It's found in highest concentrations in our blood platelets and white blood cells. What's fascinating is its ability to upregulate actin, a protein crucial for cellular structure and movement. In my practice, I've found TB500 particularly valuable for three types of patients. First, those with acute injuries, especially soft tissue or muscle injuries. Second, patients with chronic slow-healing conditions like tendinopathy. And third, athletes looking to enhance recovery and prevent injuries. Let's talk dosing. Here's my standard protocol, which you can adjust based on your clinical judgment. For acute conditions, loading phase, 5 milligrams twice weekly for 4 to 6 weeks. Maintenance, 5 milligrams monthly. For chronic conditions, initial dosing, 2.5 milligrams twice weekly for 6 weeks. Maintenance, 2.5 milligrams every 2 weeks. Now, administration technique is crucial. TB500 is given subcutaneously. I tell my patients to choose a site on the abdomen about 2 inches from the navel, clean the area thoroughly with an alcohol swab, pinch the skin gently, insert the needle at a 45-degree angle, inject slowly and steadily. Here's something critical about timing. For acute injuries, earlier administration yields better results. I try to start treatment within the first week of injury when possible. Let me share what you should expect to see in your patients. Typically, they report reduced inflammation within 24 to 72 hours, improved range of motion in 1 to 2 weeks, significant pain reduction by week 2 to 3, enhanced recovery speed throughout treatment. Before starting TB500, here's your baseline workup. Complete blood count, comprehensive metabolic panel, inflammatory markers, CRP, ESR, document baseline imaging when applicable, thorough physical examination with measurements, photos of visible injuries. Now, let's address contraindications. You'll want to avoid TB500 in patients with active or recent cancer history, autoimmune conditions, pregnancy or breastfeeding, active infections, uncontrolled diabetes. Let me share a case study that illustrates optimal use. I had a 45-year-old tennis player with chronic rotator cuff tendinopathy. Traditional treatments had failed. We initiated TB500 at 5 milligrams twice weekly for 4 weeks. By week 3, he reported 70% improvement in pain and function. By week 6, he was back to playing tennis with minimal discomfort. Here are some clinical pearls I've learned. Combine with BPC 157 for enhanced results. Time injections post-workout in athletic patients. Use BAC water for reconstitution. Store reconstituted peptide in the refrigerator. Discard after 30 days. Patient education is crucial. Teach them about proper storage, refrigerated, sterile reconstitution, injection technique, expected timeline, potential side effects. Speaking of side effects, they're generally mild but can include fatigue for 24 to 48 hours post-injection, mild headache, temporary hair growth stimulation, light head rush during injection. For documentation, maintain detailed records of initial assessment, photos when applicable, treatment plan, patient response, any side effects, progress measurements. Remember these key points for your assessment: loading dose, 5 milligrams twice weekly. Maintenance, 5 milligrams monthly. Route, subcutaneous only. Duration, 4 to 6 weeks initial course. Monitor, symptoms and function. In our next video, we'll discuss combining TB500 with other peptides for enhanced results.